Hey Dwells, so today I'm going to be explaining GABA dysfunction and benzodiazepines because that seems to be an area where a lot of people are struggling. So one of the biological factors that may contribute to the development of and perpetuation of a phobia is a dysfunctional GABA neurotransmission. Now, the reason why I've said may contribute to the development, it doesn't necessarily mean that it will. There might be other factors such as social factors or psychological factors which lead to the phobia. So having GABA dysfunction doesn't automatically mean you're going to have a phobia. It just means you're more likely to. So what is GABA? So GABA is one of several neurotransmitters that have been identified as playing a role in the experience of anxiety. Gamma-aminobutyric acid, or GABA, is a primary inhibitory neurotransmitter in the central nervous system. When GABA attaches to a protein in your brain known as a GABA receptor, it produces a calming effect. This can help with feelings of anxiety, stress, and fear. It works throughout the brain to make a postsynaptic, so a receiving neuron, less likely to be activated. So it inhibits excitation or firing. Without the inhibitory effect of GABA, activation of postsynaptic neurons might get out of control. So these glutamate neurotransmitters, right, keep getting passed across faster than what they probably should be. And this often leads to seizures such as epilepsy, but it can also lead to anxiety. So if you continually have these postsynaptic neurons firing constantly again and again and again and again and again, you're going to have issues with an increased heart rate, and a few other things that lead to anxiety and phobias and things like that. So GABA dysfunction usually leads to too much glutamate being processed. So for example, glutamate is a primary excitatory neurotransmitter in the central nervous system. It works throughout the brain to make postsynaptic neurons more likely to fire. It is involved in fast-acting neuronal transmission throughout the brain, and also aids learning and memory by strengthening synaptic connections. So you need glutamate, right? And you need GABA, but you need an equal amount of them. So the inhibitory action of GABA counterbalances the excitatory activity of glutamate and vice versa. So you can't have too much of glutamate and you can't have too much of GABA, right? So when you have too much of these or not enough, it means that you are going to have serious issues both mentally and sometimes physically. So GABA and glutamate have important roles in regulating central nervous system arousal. However, when there is GABA dysfunction, the neurotransmitter glutamate is not regulated, and too much glutamate is being processed in the receptor sites of the postsynaptic neuron. Likewise, the calming effect of GABA on the GABA receptor is not experienced, which can lead to anxiety, stress, fear, and ultimately phobias. So you need GABA to slow down that process, right? It means you'll have less anxiety and fear if you have an equal balance of the two. So when you're looking at GABA dysfunction, you need to remember the benzodiazepines tend to not replace but mimic the whole idea of GABA. So the use of short-acting anti-anxiety benzodiazepine agents, GABA antagonists, can be used in the management of GABA dysfunction and phobic anxiety. So the benzodiazepine receptors interacts with a receptor for GABA, a major inhibitory neurotransmitter, and enhances inhibitory effects. So when a phobic reaction occurs, for example, to the sight of a spider for an arachnophobic person, all the physiological functions are triggered to react as the flight-fight reaction kicks in. So it's making sure that the physical reactions associated with that fear, so the flight-fight-freeze response, are likely to actually be lessened if you have more GABA, or at least have an equal balance of the two. So with pharmaceutical drugs like benzodiazepines, their action of binding the GABA receptor site mimics the effect of the main inhibitory neurotransmitter in reducing the firing of relevant neurons. So it's making sure that the neurons aren't being sent across that increases anxiety and stress and all that sort of stuff. So if they'd been allowed to fire, they would have mobilized all the physiological functions, beginning with the release of adrenaline that increases the heart rate so dramatically and increasing blood pressure, breathing rate, and body temperature and all the rest. You need GABA to make sure that these neurons do not fire, right? Because you don't want them to fire, because if they fire, you start having the flight, fight, freeze response. And people with phobias tend to actually have the flight, fight, freeze response because there's not enough GABA being passed across the pre and the postsynaptic neurons. So the calming of these functions by the interaction between GABA and the benzodiazepines, as well as the muscle relaxant effect the drug provides, effectively reduces the heightened anxiety caused by the phobic reaction. So essentially, benzodiazepines add to the GABA neurotransmitters that are being transmitted, right? And it ensures that the neural connections slow down and it reduces that phobic reaction. So you're less likely to be phobic to spiders, or at least you're not going to show as much of a reaction. The disadvantage of benzodiazepines. Benzodiazepines may treat some of the symptoms of a phobia, but does not treat the cause of the phobia. So it might actually reduce the anxiety and the physical associations of the phobia. However, you're still going to have the cause of the phobia. You're still going to fear spiders. You're still going to fear dogs. It is not treating that. So it's usually used in combination with psychological and social treatments. Likewise, benzodiazepines have an addictive quality to them and should only be used in the short term to treat a phobia. Benzodiazepines also have a negative side effect, and over time the individual can develop a tolerance to the drug, and some people who do have benzodiazepines over a long period of time or misuse them tend to actually have benzodiazepine withdrawal. The main feature of it when it relates to phobias and VCE is that first stop point, right? Is the fact that they treat the symptoms but not necessarily the cause, and it's only the physical symptoms that it treats. Study. Most of you aren't, but still.